we're going to talk about your thoracic posture. Do you have a forward posture? Is your upper back rounded? A couple things we want to keep in mind. First of all, there are some people that genetically have a more forward posture. That usually can't be changed. Maybe it can be improved on. It depends on a case-by-case basis. But if you have a forward head posture and you have this forward kyphotic posture, chances are we can improve on it. So kyphotic posture impacts your thoracic spine, which are the 12 vertebrae in between your cervical spine, your neck, and your lumbar spine, your low back. Our thoracic spine is connected to our rib cage. This is called your costovertebral joints. Our thoracic spine is responsible for movement, flexion, extension, rotation, and breathing. The ability to get a nice, deep breath and get all of that oxygen into your lungs is a component of how well your thoracic spine and rib cage can move. Often we start to get tension in this upper back between the shoulder blade area or neck upper trap area when we have this forward posture. There are changes in the dynamics of how the muscles work in forward posture. The shoulder tends to pull forward as a result of gravity pulling it forward. Usually in a nice upright posture, our rotator cuff muscles, which are deep around that shoulder girdle, can support our humerus. However, in this forward posture, they can't work as well. They are now out of alignment. The muscle fibers can't resist the gravity as well because they're so tiny. And as well, the lack of alignment puts stress and strain on other muscles, such as your biceps and your triceps. This is often one of the reasons why people have pain when they lift our arm up. It can be an aggravation of the tendons of one of these muscles. Anteriorly, so in the front, we see that this forward posture creates a restriction and compression of the chest. Underneath here, we have our diaphragm, which when we take that deep breath, you can see my chest comes up. So one of the things we look at is your sternal angle when you breathe. As your sternal angle comes up, the diaphragm presses down. If we're restricted, we can't get that nice deep breath, and you can see that sternal angle didn't move very much. Tightness and restriction of the diaphragm can lead to other problems. The inability to get a deep breath and the inability to get all of that oxygen into your lungs will also impact how oxygen is delivered and how much is delivered to your body. This includes your organs, your muscles. Everywhere in the body, the cells require oxygen to do work. However, if you're not getting enough oxygen, this over time, over many years, can lead to other problems such as metabolic dysfunction, and it can lead to other diseases. What can we do about your posture if you're stuck in this forward posture? One of the things that occurs is we get tight pectoralis muscles. These are the muscles in the front. You have your pectoralis major, which runs from your humerus to your clavicle, your sternum, and down your rib cage. And then you have your pectoralis minor, which runs from these three ribs up into the shoulder blade. Those muscles can be accessed, if you're daring, from the armpit, the axilla. If you take your fingers and you wrap them around that front muscle and you just hold on to it. This does not have to be deep or hard, just hold on to it. Then begin to lift your arm up into flexion, and you'll feel how the fibers and how that skin wants to pull back. Try to pull that skin downward. Now be careful because you do have some nerves here, so use very gentle pressure, just compressing and pulling on the skin as you're lifting that arm back. Make sure you practice this on both arms. This can be helpful in starting to alleviate some of the tension in the front. Now, some of that tension could be coming from tightness in your rectus abdominis. Have you ever thought of massaging your stomach? Using that same technique, fingertips on the top of your rectus abdominis, so right under here, lift your chest up and come back down if you have that thoracic mobility. And that can also be helpful in opening up the front of your thoracic rib cage. Along the back, When we lift our arm up, we should have extension of the thoracic spine. However, in this forward posture, we end up getting what's called protraction of the shoulder blades. That's when they start moving forward and anterior. There's less connection or less ability between the rhomboids to contract to pull the shoulder blades back. They're still connected, but less ability to function as there's been changes in the tissue from the lengthening and the tensioning. So what we can do, even if you're in this forward posture, start to bring your arms up, and as they get to this range, lift your fingertips up to the sky and extend through the wrists. What that begins to engage are the muscles along the backs of our arms all the way into our back. What you will start to notice as you do this, hold and then bring back down and then repeat, is that you'll start to feel the muscles in your upper back working. If you are someone that has never done this before and is very kyphotic, I suggest you do this in sitting as opposed to standing, because one of the compensations that can occur is we lift our arms up and then we just arch through our lower spine. We don't want any more tension through our lumbar spine. I prefer these dynamic movements because they help to move and mobilize fascia that has become restricted and tight over time. It also helps to improve the ability of the rib cage to open when you take a deep breath. So the third thing you can do is take notice of how you are breathing and how well that rib cage is opening. You can look in the mirror, look at your sternal angle, so that's from your clavicle down to that bone, and you can place your fingers there and then take a deep breath and see if there's a change. See if that angle lifts or if it stays put. Over time, you might notice a difference, maybe not right away. So give it some time, be patient, and work on these exercises daily.